to ensure universal access to sexual and reproductive health services in Nigeria. The Federal Ministry of Health, in partnership with World Health Organization, Pathfinder International, and other stakeholders, hosted a gathering of journalists from different parts of the country to further filter down the need for self-care and orient newsmen on the national guidelines on self-care for sexual, reproductive, and maternal health in the nation's capital. Clairvis correspondent brings us detail of the event. According to World Health Organization, half of the world's population still lacks access to basic healthcare services. Every year, 100 million people are further pushed into poverty due to unaffordable care. Thus, innovative approaches like self-care interventions will serve as a game changer to further unburden the healthcare system in the country. Remy Bajomo, Director and Head of the Vesico Virginia Fistula Control Branch in the Federal Ministry of Health, spoke on government's contribution and self-care services available in the country.
It's about preventing, promoting your health, preventing illness or disease, and working within a framework of either with the help of a health provider or without the help of a health provider. But what that means is that it's actually done within the health system. The first point of contact is with the health worker. And then after the first point of call, where you are counseled and so on, and depending on the type of method you want to take or the test you want to take, you are provided with information, you are sensitized.
Stakeholders present at the event further spoke on available self-care services and how to access such service.
Recommendations you see is not just somebody woke up and felt like recommending them. There were trials, there were tests done in terms of safety, and in terms of the feasibility of it not causing harm to whoever is doing it. So that's for contraception, the DMPAC self-injection. But then we also have other ones. For instance, for cervical cancer screening, we have the HPV self screening as well. Then we also know for a long time we've had the HIV self screening as well. Then outside of SRH, we know that we also have the malaria test kits.
When you require attention, knowing when you require medical attention, that is the beginning point of self-care. The system before. System has already profiled the person to say this person, you can benefit from this, you can benefit from that. Before the person just starts up and starts using it by herself.
It gives the woman autonomy. It gives her the power to be able to manage her future. You already know. You don't see mama will carry 12 children and is still pregnant. That's an importance of self-care. Self-care also with the HIV self-testing kit. You already know there's a lot of stigmatization around HIV, of course. But for somebody to walk up to a place, pick up a test kit, be able to self-test, get the appropriate result of that test, and be able to follow the next instructions, whether there is a positive or a negative implication of that. There's also the HPV sampling. A lot of women today are already uncomfortable with medical, touch of their different private bodies. But what can they do? If you have a self-sampling stick where you take the swab yourself and bring it back to the health center to be able to test for the HPV virus, you understand you have just carried out self-care.
Self-care services available include services in antenatal, delivery, postpartum, and services for family planning, including infertility services, eliminating abortion and combating sexual transmitted infections, include HIV, reproductive infections, cervical cancer, and other gynecological morbidities.